I'm Dr. Christy Gibson, and I study trauma therapy. So if you are a patient or client looking for different trauma therapies, or if you are a professional that's looking for some training, here's some tea. Today we're going to talk about accelerated resolution therapy. So this is one of the very first trauma modalities that I studied back in like 2017-18, so it's been quite a while now. And I've also done the enhanced and advanced training protocols. I studied accelerated resolution therapy because as a family doctor, I had a lot of patients with PTSD and complex trauma in my practice, and I didn't feel like I had any skills, and the training was quick. It was a 3-day long weekend, and lucky for me, the head trainer for Canada and a lot of Europe, she actually lives in Calgary, so she does almost monthly trainings in Calgary. So her name is Colleen Clark, and I will link her information in the notes today. She's an exceptional trainer, so that's why I wanted to recommend her. And when I studied accelerated resolution therapy, it was interesting because compared to a lot of the therapies I've studied since, once you've done that 3 days, you're kind of like set out to say, hey, go do this thing. And I think it's because they give you such strict instructions. It's very, very manualized. So the creator of ART, she calls it art therapy, or I guess that's redundant. Accelerated resolution therapy is art. And she was EMDR trained. So that was kind of part of the foundation for art. And for people who've studied both, they can see lots of similarities, but Leni Rosenzweig's, the person who created art, does not believe that it's that similar. Here's what I know, not being EMDR trained. A main similarity is that it tends to use bilateral eye movements, which is moving your eyes from side to side. And that is something that lots of different therapies do, a bilateral movement or bilateral action. And it is something that creates calming brain waves. So when they've done some studies of subjects moving their eyes from side to side and they measure their brain waves with an EEG type instrument, delta and theta waves show up, which suggests that the body is calming down. So something to do with bilateral movement. And a lot of folks don't necessarily do the eye movements because for some people it's distracting. So they might do tapping, they might press a button on either hand. So there's lots of different options to move bilaterally, but that's definitely one similarity. Art is a very manualized therapy. So she kind of gives you this, the typical script, which is 16 pages, I think. And there are a few options in terms of do this or this, include this protocol or not. But by and large, it is a very set script and it's effective. So in the folks that I've used it with, it's well into the hundreds, probably more than 1,000 at this point. And I find it very efficacious. Does it work for everybody? No, but trauma therapy doesn't work for everybody. Here are a few places where it may not work. So folks who have aphantasia or an inability to imagine might struggle with the protocol because the protocol says watch a movie in your mind of the event or the series of events that happened, and then watch the movie in a different way and then change the movie. So if you struggle to imagine concrete things, that instruction to imagine a movie can be impossible. There are workarounds that I've developed, but Leni says that you have to stick with the protocol to call it art. So the protocol itself can be difficult in that scenario. The other scenario I've found challenging is I work at the refugee clinic, and the protocol uses a lot of wordplay, especially when you get into the enhanced versions. So there's one protocol for change where you think of change as something that's like coins in your pocket, because in English, that's the same word. And so Leni uses a lot of wordplay in that sense where a word might have a double meaning in English, but it doesn't necessarily have a double meaning in a different language. So 80% of my consults at the refugee clinic are folks that need language line translators, and that interpretation doesn't work for wordplay. So There are a few cases where it's just a very challenging protocol to use. And for lots of other people, it's incredibly beneficial. One of the things I love about art is it tends to be a single session therapy, especially for people who've had an event-related trauma. So that's like a car accident, a natural disaster, a single thing that happened to them. That can be really amenable to a single session of art therapy because you change a really brief movie, and it can be quite simple to do that. With relational trauma or complex trauma, developmental trauma that happens throughout childhood, that can be trickier to do with a single session, and you might need more than one. Although I have found some folks can do it if they put, I like to say, put the scenes that haunt you into the first movie, and then we will start to change the movie after. So if there is a recurring theme of the developmental trauma that they encountered, a single session might be amenable to erasing and replacing the associations. So memory reconsolidation pathways all have in common erasing and replacing associations. So that is the way that trauma memory is encoded in a different way to other memories. And what art does really well using this movie technique is it changes the associations, both the physical sensations and the emotions that come up, because what you instruct the patient is you're going to be watching this movie, and then when we pause the movie, we're going to process anything that came up while you were watching. So the emotions and physical sensations, and then over time, typically during the protocol, those start to become more neutral and eventually possibly even positive. And then you process them in a different way. So the cues that you're giving to rewrite the movie help people change those associations. And the goal is to not forget the memory. The goal is to have different associations with the memory. So when you pull that memory up later, the same emotions and physical sensations of the original event are no longer there. That's memory reconsolidation, and it's very effective at that. There's a lot of interventions in the original protocol that can be useful for folks. So there's one called the box intervention, where you would have all your younger selves bring a movie that the person doesn't have to watch or interact with or change. You just say, bring the movie that they need to into this big bonfire. I do change this a little bit in that I also ask if they have ancestors that need to bring movies as well, because there's very few methodologies that are amenable to managing ancestral and epigenetic trauma. So the traumas that we inherit that we don't necessarily have the story for, we certainly can't watch the movie except in very rare cases. And if we can't tell the story, it can be hard to process in a normal way. So this bonfire intervention can be really useful for that. The main reason why I love art is it uses so much creativity and metaphor. And it's my belief that metaphor and this kind of subconscious way of interacting with our story is one of the best doorways into managing trauma. So our subconscious mind's language is imagery and metaphor, and art is full of that. In fact, most of the folks that I work with, when we finish an art session, they're tired because it's like their brain ran a marathon in terms of neuroplastic rewiring changes, but they typically feel quite good at the end of a session. Like they don't feel wrung out. They feel like positive. They feel hopeful. I've heard words like giddy or magic, which is a pretty great feeling having done some heavy trauma process work. So I obviously can't answer if art is right for you, but I just wanted to provide some baseline knowledge so you might be able to make that decision as either a client or patient or a therapist wanting to learn more.